Hello and welcome to Island Health's introductory video called Getting to Know Overhead Lifts. We hope this will be a helpful resource as you begin your employment here. Always complete a point of care risk assessment prior to any patient handling care. This assessment may be displayed like this on any paperwork or care plan. In this video, we will explore the many uses of ceiling lifts, their basic functions and components. Handling patients is an important responsibility for all healthcare workers. Best practice is no manual lifting of patients. And this is reflected in our Island Health no manual lifting protocol. Therefore, an overhead lift system is the safest and most effective way of transferring and positioning patients in home and healthcare settings. Common procedures for using a lift would be transferring patients in and out of bed, to a chair, toilet, stretcher, and can even be an effective tool for fall prevention. Like during assisted standing and walking tasks, as well as bathing tasks. The ceiling lift makes it the safest method for the caregiver to lift and transfer the patient, resident or client while still providing comfort and dignity. The components of an overhead lift system. The lift system comprises of ceiling-mounted tracking, an electric motor and various slings. Let's look at the different forms of tracking first. A monorail or J-track system is an older design that allows the motor to travel back and forth on a single railing. The spider system is also an older design which covers multiple beds in a common patient room. It is comprised of several single tracks and one or more centralized turntables. It allows for a single motor to cover several beds and into the washroom. And finally, the boom and gantry, which is our most common system. It provides greater coverage and function to cover most of the area in a patient or diagnostic room. Turntables. In regards to these turntables, there are currently two types. This manual 16-point turntable pictured allows the lift motor to change direction to another monorail. The turntable is operated manually by pull cords. This power version automates the process by using color-corresponding buttons on the lift motor's hand control. Now, let's discuss overhead lift motors. Island Health uses two different brands of motors, both of which come in many lifting capacity sizes ranging from 440 to 1,000 pounds lifting capacity. They are run by rechargeable batteries and can have weight scale options too. They also have a carry bar which raises and lowers and has hooks for sling attachments. Our first brand we will look at is Handicare. They make tracks, motors, and corresponding slings. Handicare's most common used model is the C model, which has a LCD display with battery charge indicator and servicing messages. It has an orange light which indicates when it is in charge mode, or a green light when in use. A red light indicates that the battery is discharged or the pull cord has been drawn. These motors have a pneumatic hand control which uses air pressure and is not electric. To raise or lower the carry bar, or in the case of power transverse motor models, they have 2 or 4 colored buttons to move the motor in particular directions on the tracking. Handicare hand controls can come in 3 styles. Manual, which just has 2 buttons for up and down carry bar control. Power transverse, which also has the up and down function, but also has 2 colored coded buttons, which can move the motor on the track and or turn a power turntable. And a gantry system control, which can have 6 buttons to move the motor in 4 directions and up and down functions as well. It is very important not to manually push or pull this motor by the carry bar, as this will cause extensive damage to the drive mechanism of the motor. The power switch for the motor is incorporated into the red emergency cord. To disable the power to the motor, pull the red cord and release. For emergency lowering, pull the red cord and hold down. There will be an audible tone for the duration of time you pull the cord until release. Always remember to restore battery power by pushing up on the tab that the cord is connected to. To manually lower the carry bar, you can remove the small cover plug and insert a hex key as shown and then turn, or use a small handheld drill. Another less common Handicare model is the P440 motor. It is used in conjunction with Handicare portable lift systems or some older monorail systems. This motor also uses a 2-button hand control. It also has a large red on-off button which doubles as an emergency shutoff. The lift will not function or charge when this switch is off. If the P440 motor is needed to be removed or relocated to another track, please refer to the portable lift video for detailed step-by-step instructions. Island Health also uses Goldman products, which includes tracks, motors, slings, and floor lifts. The Goldman motors are also a ceiling-mounted motor with an accompanying hand control. The motor is switched on by pressing any button on the hand control. A green light on the motor will indicate that the hoist is ready to use. It switches off automatically after 2 minutes on an activation. Goldman has an option of an integrated electronic weigh scale with the display on the hand control. The motor has the option of being charged in a docking station, or a charging system in which the hand control is plugged into charge, or a continuous charge system whereby the motor charges anywhere on the track. The motor's lifting capacity is labeled on the motor. It ranges anywhere from 440 pounds to a 2-motor system that can lift 1,000 pounds. Pulling the red strap will cause immediate stoppage of the raise and lower function of the motor. To deactivate the emergency stop, push in the reset button, located on the motor. Just like the HandyCare motor, emergency lowering of the carry bar is done by prolonged pull of the red strap. In all models, regardless of manufacturer, the carry bar can be lowered far enough to lift a fallen patient off the floor. Portable lift systems. Now is a good time to introduce the portable overhead lift systems that are not commonly found at facilities but more so in the community. We have portable systems that can be temporarily set up in facilities or clients' homes. These systems can be a single track supported by 2 or 3 vertical beams, or can be a boom and gantry system supported by 4 vertical beams. All these versions are available from our 2 preferred lift vendors. If you would like more information on these products, please contact your Island Health's Health, Safety and Prevention Advisor for assistance. In summary, before you use the lift, remember these steps. Do a visual inspection. Know the weight limit of the system, the motor, tracking and sling. Inspect the sling strap for wear. And check the charge level of the motor. The third component of the overhead lift systems are the slings. Please refer to our Island Health overhead lift slings video for in-depth discussion on the many types of slings available. Thanks for watching Getting to Know Overhead Lifts. Be sure to check out all our other videos on our YouTube page.